I'm going to be like on this side, so I hate asking you guys if y'all want to move, because of this like big giant computer right here, like it's kind of like blocking my view of y'all. But if you guys don't want to move, I totally understand. I can come around like this, so, but I'm just saying to like that side, if you guys have questions, it doesn't matter. Okay, I'm going to get started. I did a practice test, so that's kind of what I'm going to go over. Y'all's test is not cumulative, and it's on endocrine, immune, and repro. And so that's kind of what I focused in on my test. So if you guys have it, can you pull it out? Because I'm going to ask you guys for the answers. Sorry. I can't see that far away. No, that's not it. Yeah, that's it. It's on SARC. It's like Google Sites, and it's SARC UCF. Okay. So the first question that should be on there is that, see, I circled the answer, so that's why I'm not putting it up there yet, but I will like slowly move it towards, because I should have not circled them at first, but there are many second messengers for a protein hormone. Which second messenger signal does insulin trigger? Does anybody have that answer? This is like for you guys, so it's okay to answer. Like talk to me a little bit. Is it which one? No, but good try. A lot of them are C-camp, but actually insulin is a special one. Does anybody find that in the PowerPoints? Which one? Yes, it's JAK2. Insulin was one of the examples that they used actually, or that she used in y'all's PowerPoints for JAK2. And JAK2 is one of the, I think, 4 other receptors that she has on there, and insulin does hit JAK2 instead of like a C-camp or something like that. Is anybody confused about why or anything like that? Okay, we good? What ion also can trigger a PTH secretion? Yes, it can. That's great. So it is magnesium. Does anybody know, though, what's special about magnesium and the parathyroid hormones relationship? Like, can magnesium always trigger, or can PTH always increase MG, or no? Well, that's the thing, is that sometimes when magnesium is at a very elevated levels, it will actually decrease PTH. But yes, it is one of the ones that was the answer. You got that right. MG does ask for PTH, but I just wanted to make a point that if there's too much magnesium, it will actually decrease PTH from being secreted as well. So that's just a note, because she could do a trick question on that. Okay. I'm not really sure how to make that more clear. What is the protein precursor for the thyroid hormone? Yeah, awesome. So I think of thyroid, tyrosine, 2 T's, put it together. And if you haven't noticed, a lot of the other hormone precursor is also follow-up with tyrosine. So that is a big one for a lot of them. Okay. Number 4. What 2 types of hormones can activate themselves without circulating through the blood? So remember, these are types of hormones, not actual, like, hormones. Correct. It's endocrine and autocrine. So you have endocrine, which travels through the blood. Exocrine, which are just secreted through a gland. You have paracrine. Am I talking loud? Okay. Sorry, I feel like I'm really talking loud. You have paracrine, which hit the neighbor, and then you have autocrine and endocrine, which do it to themselves. So those are the 5 types. Hormones can inhibit each other's functions, enhance each other's functions, and work together to perform the same function. Which hormones work to perform a permissive effect? Which ones? No, actually not. That's not correct. Cortisol and aldosterone, they enhance each other's effects. Permissive is when they work together to kind of do the same function. It's not enhanced and it's not inhibited, so it's like always going to be the same. So there's 2 other hormones on there that have permissive effects. Norepinephrine, is that what you said? Yes, it's cortisol and norepinephrine that work together as a permissive, and they still perform the same function. So one of theirs isn't enhanced and one is not inhibited. That's what permissive means. It's like the same throughout still. A synergist effect would increase it. Okay. So a 35-year-old male comes into the doctor's office with erectile function disorder. The doctor prescribes him a vasodilator medication to help him with his issue. Which second messenger could not be triggered to cause erectile dysfunction? I don't know why I put could not, because I meant could be triggered to cause erectile dysfunction. Or I meant which one is basically broken for an erectile dysfunction disorder. Sorry, I worded that really weird. I'm really sorry, you guys. So which one would be broken, basically, for an erectile dysfunction? Yes, it's C. It's guanylate cyclase receptor, and that's because in it is NO, nitric oxide, and nitric oxide is what makes vasodilation and causes an erection. So that's what the receptor would basically be. For a protein hormone to be made, it takes organelles in the cells to create them. Where are protein hormones made and then go through post-translational modification to be shipped out of the cell? This is every protein, by the way. Correct. Endoplasmic reticulum to Golgi apparatus. The endoplasmic makes them, Golgi makes their functions, makes them the proteins that they are. So, great job. Number 8. Which hormone has a faster response and why? Protein hormones, it binds straight to the cell surface, so it gets to the target receptor faster. This is correct. I used to think that it was the steroid hormone because you would think because it can just go through, but it takes it a lot longer to get through the whole cell into the nucleus than a protein can to the cell surface. Number 9. What vitamin is lipid soluble and binds to the nucleus as its receptor? This one was kind of a giveaway, I feel like. Which vitamin? Yes. Vitamins C, B12, and B2 are all H2O soluble. So those are some of the H2O soluble vitamins in general, so that can't be a steroid or a lipid soluble substance in general. Okay. Number 10. How does the hypothalamus talk to and send its hormones through to get to the anterior pituitary gland? Anterior, not posterior. y'all's first slide, I'm pretty sure. First or second slide of the endocrine of A. Not posterior, anterior. If you read down a little bit further, it says anterior. Yes. Okay, so infundibule and capillary plexus is the nerve complex, and then portal capillaries are always for posterior and anterior, but the specific part would have been the plexus. So great job. Any questions so far? Or we get, yes. No, totally. That's why I asked. It's because I felt like I was going fast. Because JAK2 and tyrosine kinase are two different kinds of receptors in general. They're very similar, but they're different. And so one of the examples for JAK2 was insulin. Tyrosine kinase, the receptor has two phosphates down at the bottom of it, and so when a hormone binds, it brings the two phosphates together for them to be phosphorylated, and that's how it works. And JAK2 has a different type of secondary action, actually, but they both deal with phosphates. That's why it kind of can get confusing. Well, then go with her slides. I'm pretty sure that it said for the JAK2 that insulin was one of those as well. I mean, yeah, it's possible that it can have two different functions. If insulin did one function, it could be the tyrosine kinase, and then if it did another, it could be JAK2. It can trigger both then. If it says it on the slide, though, go with her stuff. Okay, so number 11. What part of the adrenal cortex increases Na plus absorption and K plus secretion to increase someone's blood pressure? So this is with the zona. So you just need to know which zona basically that this one is for. First off, which hormone is this that does this function? Yes, so which zona is aldosterone? Yes, and I think of it as the fact of with zona glomerulosa, it sounds like the glomerulus, and that's how the renin system is. It's in the kidneys, so that's the glomerulus, the kidneys, Na plus absorption, that it all happens there. So that's what kind of makes me combine those two to remember that it's the glomerulus with aldosterone, if that made sense. Okay, so number 12. Which of the following does not trigger mineralocorticoids to be released? Yeah, awesome. So it's actually Na+. We reabsorb Na+, but a decrease does not cause aldosterone to be released. So ACTH clearly does, because that's the hormone that triggers it, and then K+ and the renin-angiotensin system as well. So watch out for trick questions like that, because you would think it would be Na+. At least I would think it would be. Okay. A 50-year-old woman is going through menopause and realizes she has a stiffness in her fingers and knees. She goes to the doctor, which informs her she is developing osteoporosis because of calcification in her joints. The doctor prescribes her an anti-inflammatory drug to reduce the tension in her joints. Which hormone is most likely in the prescription? Parathyroid is not anti-inflammatory, but I mean, that's good thinking because it does have to do with calcium. Cortisol. Cortisol is our anti-inflammatory drug. When your grandparents go to the doctors and they get prescribed with osteoporosis, normally they'll get a cortisol anti-inflammatory prescription. So it suppresses the inflammation in joints and stuff. Okay, to make catecholamines, we have to go through a synthesis process starting with an amino acid that gets transferred to other compounds by enzymes. If someone didn't have any epinephrine being created in their adrenal medulla, which would best be the reason for this problem, specifically? Which one? Yeah. Sorry, hold on 1 second. Let me just see that slide. I just want to see where that enzyme's at. Okay, so that enzyme is from dopamine to norepinephrine. What specifically would cause epinephrine? To not be made. If norepinephrine was being made and epinephrine wasn't, what would cause epinephrine not to be made? Yeah, no, you're right. It's the enzyme. If you're having a deficiency of one but not the other, normally it's an enzyme problem. So it would be phenylethanol, amine, and methyltransferase. So basically, the NH2 isn't getting transferred into another compound, adding that methyl group onto there. So yes, it would be A, like specifics. See, I felt like that was worded. Maybe I should have been a little bit more specific in that question. I thought about that when I was putting that on there. A 28-year-old is obese with a decrease in body temperature, low O2 consumption, memory and learning loss, and has bradycardia. When the doctor gives her a diagnosis, he explains she has hypothyroidism, which could be a cause of her disorder. Awesome, yes. So this enzyme right here, I feel like she could really ask you a lot of questions about this because this literally is the enzyme throughout the whole entire reaction. It only has one enzyme, so if you don't have this enzyme, you literally are without the full T3 and T4 being produced. So B is correct. She isn't producing the peroxidase enzyme. Which of the following is not a true statement? We have A, TSH stimulates the thyroid gland while TRH stimulates the pituitary. T3 and T4 are steroid hormones while TSH and TRH are protein hormones. When too much T3 and T4 are being made, they inhibit TSH from stimulating the thyroid gland. T3 and T4, when stimulated, can imitate the sympathetic nervous system. Which one of those is not true? Awesome. So which one does it stimulate? If it doesn't stimulate, if an increase in T3 and T4, it doesn't stimulate TSH, it stimulates TRH to decrease the whole entire. Remember that it's not the stimulating hormones in the anterior pituitary that get the signal that there's too much being produced. It's always the hypothalamus because the hypothalamus controls the pituitary. So it's never that when it's a negative feedback. hormones are carried through the bloodstream by globulin, while protein hormones can diffuse into the blood and travel without globulin. Yeah, definitely true. Remember, blood is H2O soluble, while if in like dissolves like, so you can carry that straight through. Lipids, not so much. I mean, it makes sense because why would a protein be carried by another? So it wouldn't promote bone formation. So what is the other one that would promote bone formation? Because the growth hormone is correct. So yes, thyroid hormone. It says it in the slides that one of the functions is to promote bone formation. So growth hormone, of course, because that's the hormone when you're a baby. That's how you grow, basically. That is like the controller, I feel like, of bone formation, but thyroid does contribute to that as well. But no, see, parathyroid, it sounds like it would make it because it is a lot with the bone, dealing with the bone, but if you think about the process of it, calcium's taken away from the bone, so it has to degenerate that bone, and that's how they get osteoporosis. Okay. When someone is sleeping, they still burn off energy. In the beginning, they still have glucose running through their bodies, but by the end, they are using other fuels to give their body energy. What hormone would be most active in the beginning of someone's sleep cycle and then be present at the end? So basically, you got to take this and say which one deals with glucose and which one deals with like breaking down proteins and lipids and stuff. First, which one deals the most with glucose, putting glucose in the blood? Okay, glucagon. So that deletes B and C. So now we're dealing with either insulin or cortisol. Does insulin put glucose even in the blood? So then it has to be cortisol. So D is the correct answer. And this is a true thing. When you are first going to bed, you have glucagon running through your body, breaking it down. But then when you wake up, you only have cortisol normally running highly through your body. And that's why, like, if you don't eat right before, you kind of get irritant, is because cortisol is also the stress hormone and can create stuff like that. Just letting you know. Okay. Dopamine is very important. It helps our bodies perform many functions, helps with making things in our body, and can make us happy. Which synthesis process is dopamine in to make a particular hormone? Awesome. What are those? What specifically are those? Yes, dopamine is norepinephrine and epinephrine. Awesome, great job. Okay. Number 21. A woman comes into the doctor's office to have an annual exam. When getting her blood pressure taken, the nurse notices her blood pressure is hypertensive. She checks the woman's urine and notices that it's acidic. Which hormone could be the cause of both of these symptoms? So which one increases blood pressure and also makes H plus go into the urine? Sorry. Close, but ADH does. Okay, that was my bad. I shouldn't have probably put that on there with it. And I was like going with your slides, and what's the other hormone that would make your blood pressure increase? Blood pressure increase. Yes, A, mineralocorticoids, which are aldosterone. That's why I put these words in here, is because she most likely will use these. So mineralocorticoids, glucocorticoids, or cortisol, oh gosh, androgen. Crap, I can't think of it right now, but those are like the names. So just try to like correlate those names with it. But yes, ADH does increase acidity, but it's not as pronounced as mineralocorticoids. Like mineralocorticoids literally, like every time they take in an Na+, will release the H+, but you have to have HCO3 and H+, like both, like HCO3 needing to go into the blood for it to have the H+ come back into the urine. So it's more of a mineralocorticoid thing that will happen with acidic urine. Does that make sense? Okay. Are we all, okay, yes. C. Those are norepinephrine, epinephrine. Do we have any other questions? I feel like I'm going kind of fast. Are we good right now? Okay, just wanted to make sure. Okay, so which of the following statement is a true statement? Cushing's syndrome is a problem with the adrenal medulla. Is that true? Cushing's? No. Okay, awesome. That's cortex. Pancreas is the only gland to secrete endocrine and exocrine hormones. Is that true? Yeah, I get a head shake. Awesome. Yes, that one is definitely true. The C then is low cortisol can cause someone to have obesity. Does low cortisol? No. See, awesome. That causes obesity. That's the Cushing's obesity symptom, is with high cortisol levels. And then LH stimulates the serotonin cells to secrete testosterone. No. Does serotonin secrete testosterone? No. Awesome. So B would be the correct answer. Pancreas is the only gland to secrete the endocrine and exocrine hormones, which I find very fascinating. I think that's really cool. Which two are the only two hormones to be made in the hypothalamus? I really wanted to make sure y'all knew this. Yes, ADH and oxytocin. Just remember it, please, because that could be an easy question on the test. So I really want you guys to know that one. Okay, true or false? Insulin inhibits keto acid formation because it won't allow lipid uptake in the liver, so pyruvate cannot be made. This one was kind of, you had to dig for this answer, I felt like, but I feel, It is false. Do you know why? Yes, awesome, that's great. It doesn't do pyruvate, it's acetyl-CoA. So it was the little, what it makes the lipids into, won't allow lipid uptake in the liver, so acetyl-CoA cannot be made, not pyruvate. I'm not even sure pyruvate has anything to do in that step of that system, but it does have to do with metabolism. Okay, so number 25. When PTH is released, why must phosphate be excreted in the urine? Is it A, it doesn't allow vitamin D to uptake calcium in the small intestine? Does that have anything to do with phosphate or PTH in general? No, right? Okay. It's in the intestine. So vitamin D with PTH is not. Okay. PO4 combines with PTH and won't allow it to release calcium in the blood. Does PO4 combine with PTH? Does that sound like it? No? No. Okay. I just want to make sure. PO4 blocks CA2 plus breakdown in the bone? Or is it PO4 combines with CA2 plus and doesn't raise blood serum levels? Yes, it's D. It's PO4 combines with CA2 plus and doesn't raise blood serum levels. So when you first break down the bone, you have PO4 and CA2 plus, and they will combine. And when it has to go down to your urinary tract, so then the kidneys can reabsorb CA2 plus and excrete that PO4. Because if not, PO4 will combine to it, and that's not free CA2 plus in the blood, so you can't use that. What is something that glucagon and parathyroid hormone have in common? They both raise blood calcium levels. Does glucagon raise calcium levels? Thank you. No, they don't. They both are secreted from the pancreas. Is PTH secreted from the pancreas? No, right? Okay. Thank you. They both have CAMP as second messenger. Is that true? Yeah. Okay, thank you. And then they both are paracrine hormones. No. So I'll just go ahead and give you that one. They both have CAMP as second messenger. Under like the different second messengers that she has on those slides, she has the different ones that correlate with those. So I feel like that's maybe a really good thing to study because she could totally ask you a second messenger question. Okay, number 27. What is not a function of insulin? Is it increased gluconeogenesis, increased glycogenesis, increased phosphofructokinase production, or decreased K+ concentration in the blood? So which of those does insulin not do? Yes, awesome. Gluconeogenesis is the breakdown of proteins and lipids. When you have insulin running through your blood, it's because it's trying to get in the cells, not break it down so the blood can have more glucose. It definitely does everything else because glycogenesis is actually changing glucose to glycogen. Phosphofructokinase production is a production that is produced in the cells with glucose. And then K+ concentration, it actually decreases the blood levels of that, or increases the blood levels of that because when it's switching, it sends the K+ out. Number 28. What hormone doesn't have tyrosine as its precursor? Does anyone know? Is it norepinephrine, thyroid, melatonin, or parathyroid? Precursor, by the way. So this is like the starting. Which one? Actually, close, but not, no. Good guess, though. It is C. It's melatonin. Parathyroid, thyroid, they both are tyrosine. And then norepinephrine is tyrosine too, even though dopamine is involved in norepinephrine, but it's melatonin. Before the pineal gland can proceed in its function, the eye has to relay its information to the hypothalamus. Which nucleus in the hypothalamus does the retina send its message to? Awesome, yes, suprachiasmatic. So the supraoptic, we already said, was involved with the hypothalamus and which supraoptic? Do you know what hypothalamus connects with which gland? Not anterior, but the other one. Okay, posterior. And then infundable, which one is that? That connects with, yes, anterior. And then our last is paraventricular, and that connects with, which one? Does anybody know? Paraventricular in the hypothalamus? It's another, it's with the which pituitary gland does it connect with? Which one? Yes, awesome. Paraventricular and supraoptic, posterior pituitary hypothalamus, infundable and capillary plexus, anterior pituitary. Remember those. I am pretty sure I got a posterior pituitary question last semester. Okay, I just want to pre-warn y'all. But ma'am, I forget this is there. Paraventricular and supraoptic, posterior. Infundable, capillary plexus, anterior. And then the only other one that says that hypothalamus is connected to is the pineal gland, and that's suprachiasmatic. Okay. Number 30, please know this question for y'all's test. I'm not sure she'll give you guys a question on it, but this would be a very easy to know. The pancreas holds 3 different hormones. Fill in the blanks to complete this sentence. Glucagon is secreted from which cell? Awesome. Insulin is secreted through, and then somatostatin is secreted through the last one. Awesome. So, D, alpha, beta, delta. I think that's my last question for main of the endocrine, so now we're about to go into repro. If spermiogenesis was inhibited in the process of making sperm, which step would be hindered? Spermiogenesis. Which one? Yes, D. So when on this slide it talks about spermatogenesis with a T, and then you have spermiogenesis that is only pertaining to the spermatid and going to the mature sperm. Okay? So that's something to remember to not get the words mixed up. Number 32. What nurtures the sperm to aid in growing and spermatogenesis? The nurturer of the sperm. Serotoli cells. That's correct. What does Leydig do? Yes. Produce testosterone. LH, what is its function? Yeah, what does it hit to? It hits a cell. Yeah. Remember LH with Leydig, because they both start with L, so L hits L, produces testosterone. And then when there's too much, decrease. So that's what. And then D was testosterone, which is not a cell in general, so I would hope that you guys would not choose something like that. Okay, so number 33. Testosterone is released the most in the mornings and the least in the evenings. Is this true or false? Yes, it's true. There is a sentence at the top of the slide that literally says that full thing. I want to say it's like a couple slides in from Repro. Okay, so what is the correct passageway of ejaculation? This is something else that y'all... Does anybody know? Yes, A is correct. So it goes from the testes to the epididymis to the vas deferens, then the seminal vesicle, prostate, urethra, and glans penis. That's the system, the flow. Okay. Number 35. Which of the following statement is true? We have the neurotransmitter for the erection is ACH. Ejaculation is controlled by the sympathetic nervous system. The neurotransmitter for erection is NO. Emission is controlled by the parasympathetic nervous system. NO. That's correct. So the neurotransmitter for erection is NO, and that's why the gliadine cyclase that I talked about for my third question is with it. With erectile dysfunction disorder is because NO is the neurotransmitter, and NO for that system, that second messenger system, is the neurotransmitter. So that's how those connect. Any questions? You good? Okay. Number 36. How is the primary osteocyte arrested until puberty? What arrests it? Yes, OMI. So, I should have had this pulled up, but OMI literally is osteocyte maturation inhibitor. That is the name of OMI. So, I mean, that literally tells you in the whole thing what it does. So number 37, when someone becomes pregnant, they can do a home pregnancy test to find out what hormone is found in the urine that indicates someone is pregnant. Yes, HCG. That is the one that is starting to be produced when a woman gets pregnant, and that's how we can tell. What is the scar tissue that forms when ovulation occurs? Okay. C. I heard someone say it, corpus albicans. She has it on 2 slides. So just maybe remember that the scar tissue is corpus albicans, because she does have it on 2 slides. So, yes. Sorry, I can't for some reason. Yes, when we're not fertilized, that's what happens. You have like something that forms, which I'm not sure if I asked a question about. So the stigma forms, and then it degenerates, and that scar tissue that's there is the corpus albicans. Where am I? Okay. Number 39. What does the sperm have to penetrate to get to the osteocyte? So is it corpus luteum, corpus albicans, the stigma, or zona pellucida? Sorry, I'm not very good at pronunciation. Yes, zona pellucida. Corpus luteum releases. Corpus albicans is the scar tissue, and the stigma is what is the thing that starts to degenerate the corpus luteum in the first place. But yes, for the sperm to actually get to the osteocyte, that is its last structure it has to go through to get there. Zona pellucida, when she talks about how to build the follicles, that's the first that forms around the osteocyte, basically calling it the primary follicle. So that's the last little shard that it has to get through. There's like a couple slides down that actually tells you what how the secondary follicle, it's like zona radiata or something, that those layers are called to form the secondary follicle. How long does a normal pregnancy usually last? Perfect, 38 weeks. And that is from fertilization, I'm pretty sure. 40 weeks is from the last menstrual period, I'm pretty sure, is what those. Number 41. What is the one and only hormone that partakes in positive feedback mechanism? Oxytocin. Please remember this. Everyone else is a negative feedback cycle. Oxytocin is the only one that's that positive. Can anybody tell me what oxytocin is that makes it a positive feedback? What is it? Yes, it dilates the cervix with the contractions. If that was a negative feedback, that would really suck for women. I mean, that would be really painful. So we need that to be positive feedback. Please remember it. And then also, like, oxy, it starts with an O, and everything that deals with a woman is O. So if you think about it like that, like osteocyte, oogenia, like all of that starts with O. So that's how, if you can remember those together. I try to think of stuff like that. Okay, so where does fertilization occur? Which one is it? Fallopian tubes. Fertilization occurs there. It's where it starts off. It's in the ampulla of the fallopian tubes. Number 43. What can be a cause of a woman having male secondary sex characteristics? Oversecretion of testosterone, no estrogen secretion, oversecretion of androgen, or an XXY chromosome makeup. It's not C. It would seem like it would be, but if you had if you had overproduction of androgen, that would mean you have an oversecretion of testosterone. So there's like only one really awkward thing that can happen to a woman that would make her literally have male secondary sex characteristics. Yes, it's the XXY. It's a genetic disorder called Klinefelter syndrome, and she has a lovely picture on a slide for you guys to see. It's kind of disturbing, but that is how women can get male secondary sex characteristics. Number 44. Which statement of the following statements are not true? Serotoli cells secrete testosterone and Leydig cells are the supporting cells. Seminiferous tubules are where the supporting cells are located. Sperm is made in the testes and mature in the epididymis. Testosterone inhibits LH secretion in males. Which ones are not true? Okay. Leydig cells are not the supporting cells. They are the ones that secrete testosterone. And while the Serotoli cells, they secrete or are the nurturing of the sperm. Why do women not undergo ovulation while pregnant? C is correct. Progesterone and estrogen an increase in both of those inhibit FSH and LH. So while a woman is prolactin does have an effect, and yes, it does work with it, because normally when you have an increase in prolactin, you have an increase in estrogen and progesterone. But estrogen and progesterone are like the main two guys that secrete or stop the LH and FSH to where you can't have any follicles grow, and then LH is what surges the ovulation to have a menstrual cycle. So progesterone and estrogen increase means you're pregnant, basically. Okay, number 46. When we get a paper cut, our immune system reacts. Which phagocytic cell would be the first to show up at the site of an infection? Is it lymphocytes, macrophages, mast cells, or neutrophils? Yes, neutrophils. I heard it. Macrophages come after. Which of the following statements are true? Microglial cells are found in the lymph nodes. The main phagocytic cell in the spleen are Kupffer cells. Neutrophils mainly react to a site of infection by chemotaxis. The phagocytes that sterilize the blood are mainly in the connective tissue. So with A, are microglial cells found in the lymph nodes? No, they're found. Do you know where they're found? No, it's okay. What? Yes, the brain. That's where they're found. Microglial cells are in the brain. The main phagocytic cells in the spleen are Kupffer cells. Does anybody know whether that's true or false? I have that they were found in the spleen, actually. Hold on, I have the PowerPoints on. Organ-specific phagocytics in the liver, spleen, and then it has parentheses, Kupffer cells. No, it says in the liver, and then it has comma spleen, and then it has specifically for spleen Kupffer cells in the PowerPoint. So that's the true statement. So neutrophils mainly react to the site of infection by chemotaxis is not correct, and then the phagocytes that sterilize the blood are mainly in the connective tissue is not correct. Number 48. What triggers the hypothalamus to regulate a fever? D is correct. PGE2 hits the hypothalamus. Pyrogen hits PGE2, okay? So remember that. Don't think pyrogen is the one that hits the hypothalamus. It's PGE2. Number 49. A 55-year-old man notices he has a stomach ache and when he eats any type of meal. He goes to the doctor and is diagnosed with a tumor on his pancreas. Which of the immune cells would have been triggered by the tumor growth? B cells, T cells, macrophages, NK cells. Close. Specifically though. Huh? Totally. What triggers the hypothalamus to regulate a fever? Or no, sorry, my fault. My question was, which of the immune cells would have been triggered by the tumor growth? So which immune cell is triggered or tries to attack a tumor, basically? The last one? The CT? Does anybody have a clue? NK cells. Those are specifically for, forget about this, for tumor. The T cells will come in there as well because the tumor does have something to do with the cells, but NK cells are like specific main guys for the tumors. For local inflammation, many cells immediately are called to action to stop the process of bleeding and to make sure no infection gets in any further. Which response causes the vasodilation for continuous blood clotting to the site? So which one promotes vasodilation? Is it when, Yes, correct. So mast cells releasing that histamine is what causes our cells to vasodilate, so then all of those neutrophils and macrophages can start getting in there and eat up the infection. Great job. Okay, number 51. When put through an electrophoresis apparatus, plasma proteins will be separated into 5 bands. Of these 5 bands, which one produces antibodies? Is it gamma globulins, alpha-1 globulin, alpha-2 globulin, beta globulin, or albumin? Albumin. What is it? Yes. Gamma globulins are they are the plasma proteins for antibodies. Number 52. Which of these plasma proteins functions in balancing the osmotic pressure? Yes, albumin. That you guys learned in lab. True or false? Most antibodies are involved in internal secretions. It is false. What are they most involved in? Yeah, the opposite. They're mostly involved in external secretions. Tears, saliva, stuff like that are classified as external secretions. Your sweat. So that's where they're mostly, surprisingly, because usually you think antibodies, you think inside. Which of the following statements are false of adaptive immunity? IgA secreted in milk and also in tears. The epitope region is the part of the antigen recognized by the antibody. Antibodies are what phagocytize the antigen. Macrophages and neutrophils are both part of the innate and adaptive immunity. C is correct. So antibodies are not what phagocytize the antigens. They are just the ones that call everybody to action. I, for the longest time, thought the antibodies were the ones that ate them and got rid of them and that they destroyed them. So it came to me as a shock when I found out that that's not exactly how it works. So just remember that the antibodies are just what signal others to come. Number 55. What is the main function of the thalamus in immune response? Which one is it? B. B is correct. It matures the T cells. Where are the T cells and B cells made? Awesome. And then where does the B cells mature? In the bone marrow. There are a vast amount of T cells that all have different functions. With all the different functions comes many names. Which type of T cells have names like TR1 and TH1? I threw this in here because I'm not sure how specific she's going to get on the immune, because she actually went over it with y'all, so I just wanted to bring out like little points like this. Does anybody have a clue though? The helper cells are one of them, so that cancels out A and C. So is it cytotoxic T cells that's the other, or is it the regulatory T cells that's the other one? Regulatory. So it's helper and regulatory. I noticed that those are the ones that normally have like the names, like different bunch of names. So 57, natural killer T cells are triggered by what compound? Lipopolysaccharide, histocompatibility complex, glycolipid, CD1, or complement proteins. I heard it. Huh? It's not, actually. Yes. Did you say glycolipid, correct? Okay. Yes, glycolipid CD1. That's what triggers the natural killer T cells. Any questions on that? Okay. Number 58. Which of the complement proteins triggers histamine release, neutrophils and monocytes, and make part of the attack complex? Which one? You are right beside the letter. So close, but so the letter, so A. So it's C5A that does the 2. It goes with C3A and C5A that do, I think, 2 of those, and then C5A, which is also part of the attack process, because it's all of the C5 that does the attack. So C5 through C9 is attack complex. Okay. Which condition is triggered by a class of antibodies? Dermatitis, inflammation of the skin, rejection of a transplant, a virus, or allergies? Allergies are correct. All the other ones are T cells. And then number 60. Which is the correct process of activation? Where complement proteins are at in that one is not correct. Think about it. Would antibodies be triggered before a complement protein complex or after? Antibodies? Because the complement protein complex eats the antigen. So do antibodies So would they be before the antigen would be eaten or after? Huh? It would be before. Antibodies would be before. What's your question? No? Okay, I just wanted to make sure. I was like, wait. Does anyone know that question, the answer to that? If not, I can say the answer, honestly. It's A. So it's pathogen enters, antigen is recognized, antibody binds, then memory antibodies are activated, and then neutrophils and macrophages are phagocytized. And both of the ones with the complement proteins, the complement proteins is out of place. Complement proteins should be one of the last to trigger because then they're also going to trigger, it's like the antibodies trigger them, and then they can also trigger the macrophages and neutrophils to come and eat it as well. So those are the two big complexes that eat the antigen for when they're like pronounced that they're in our body. But antibodies, T cells, those are always the ones that like, hey, something's wrong. So I literally, like, this is not supposed to be done with until 5. So I have literally an hour. I was not expecting it to go that fast. So if you guys have any questions about anything, any system, anything, talk to me. Yes. The hormone phases, okay. So she asked for the menstrual cycle, which I'm going to. That should have flipped it. Okay. So, let's go repro. That, by the way, that's Klinefelter syndrome. So with the menstrual cycle, first you're going to have FSH. FSH is going to be first because it's the one that builds the follicle. That's why it's called follicular stimulating hormone. If you listen to both of those names, actually, with FSH and LH, even though they're both in the male and the female reproductive system, their names pertain more towards female reproductive. So the follicular stimulating hormone literally is stimulating a follicle to grow. So that's your first step. So that's why it's an increase in that before. And then the luteal phase, which is LH, the luteinizing hormone, which triggers ovulation, is going to increase, dramatically right before ovulation, just because that's what basically is the signal of degenerating, breaking down, and so you can go into ovulation and then your menstrual cycle. So this graph to me was always really confusing, I'm not going to lie, to read in the first place. Estrogen also peaks right before ovulation. That's another one that definitely does. And then progesterone is peaking like while we're ovulating type of thing. My suggestion for if you guys don't understand the menstrual cycle with the hormones is that the BRS has a really great explanation for it. Actually, a lot of the questions in the BRS can answer. Truthfully, it's very descriptive in the BRS. But those are normally, you really just for menstrual cycle would need to know about ovulation with FSH and LH and when they surge. I would say that's the biggest. Those are the two biggest ones. Did I answer your question? Where are you at? Yes. You asked me if that's when we have menstruation. No. So follicular phase is after we have menstruation, because it's the body's getting ready to. Because when the follicle grows, it's basically asking it to be fertilized, And so while we're menstruating, that's like no fertilization can happen. So once we're done with that, another follicle will grow to try to become fertilized, basically. So that's when we have it, is right after, because that's when it starts to regenerate from the primary to the, or from the primary osteocyte to primary follicle to secondary type of thing. Yes. Which one does that? LH. Are you talking about hormone-wise? I'm pretty sure LH is the one that does that. Why? What does it say on there? LH testosterone. Because if you don't have enough, like the hormone LH being stimulated, which stimulates the secondary sex characteristics to descend that when a boy is a baby, that's what happens, which is frequent. It's kind of scary. You have to have surgery on that. Did that answer your question? Okay, awesome. Do we have any other questions? Yes. The corpus luteum. So when that's, before the placenta is made, corpus luteum, sorry, I'm bad with the pronunciations. They're like crazy words. That's the one that is basically fertilizing that egg at that time until the placenta generates itself. So that's the one that's secreting the HCG, and that's the one, that's why we can know so early on, is because the corpus luteum is the first to be fertilized and everything. Any other questions? Seriously, I mean, like, ask away. Like, if something's confusing, please don't hesitate at all. This, like, helps other people talking about it, honestly. So are we good with, like, the endocrine system? Are there any questions with that? Or is it just, like, trying to generate the information, basically? Are we struggling with knowing the information of any of this? Are any of the processes kind of hard? No questions dumb. Like the ones like the C camp and stuff that I was talking about, that is what your hormone triggers. So it's not a hormone itself. It is a receptor, and they're protein receptors, and they just like filter. So like specifically with the C camp one, that is like probably the biggest one that I would say that we have. You hit that, and you stimulate G alpha protein, which and then you just stimulate proteins all the way down. So that's basically what it does, is like it triggers the cell to, hey, do a function type of thing like that. So specifically for muscle contraction, C-camp is one of the receptors that hits with acetylcholine, and it triggers all the way down, so then the calcium can be released to trigger that muscle contraction and bind to TNC. That's an example that's more common, but with hormones it does the same thing as well. Of course. And then, like, we know that, like, with steroid, that hits nucleus, and it gets filtered into DNA, and then DNA make RNA, RNA make proteins. That's how that system works, instead of just automatically being hit by a bunch of proteins. So that's why the steroid hormones are basically made in the DNA. And then protein hormones just function out what the protein wants us to do. Any other? Yes. the other options? So he was saying that a woman is pregnant, has polyuria, obese, and the doctor told her to lose weight. That's what he said. So what are the other options for that? Type 1? Okay, so it's definitely type 2 diabetes for sure. Gestational diabetes can also be a name for that as well, because when someone's pregnant, they can end up having diabetes because of it, because when a woman's pregnant, her hormones go ridiculous. Like, it is crazy. You have to get everything back in balance. With type 2 diabetes, though, you will always have obesity. Type 1, you will actually have someone that loses weight. So that's like one of the biggest differences between the two, actually, which is surprising, but type 1 is an autoimmune disease, though, so it kind of makes sense. Type 2 diabetes, if you think about it, the reason why they happen in the first place is because when someone is overweight, they normally are ingesting too much glucose. And how right now you can't feel your shirt because your brain shuts off that stimulus until you just thought about it like that. But before you couldn't feel your shirt, well, that's kind of how it happens with receptors as well. If a receptor is getting too much of the stimulus, it's going to eventually shut off. And that's what our brain does. And so when someone's overeating way too much, diabetes, because it won't uptake that glucose anymore into the cells. Are we good with like functions of the hormones in general, like how insulin uptakes glucose and also pushes K plus out, how glucagon takes the blood glucose and releases it out. Cortisol also breaks down stuff, but then makes you have like hypertension and stuff like that as well. Like, are we okay with the specifics in that? PTH breaks down bone, but it does something else. Sorry. Yes. I didn't hear what you said. Yes, that's how it separates itself from Ca2+. Is Ca2+ can go back into the blood, and phosphate can't be back absorbed, so it goes into the urine. That's how they break them apart. So it can be Ca2+ running through the blood and not Ca2+ phosphate, calcium phosphate. Yes. In the kidney, or every time. So when you're entering the kidney, it will be calcium will go back into the blood, and phosphate will just keep going down the path of the kidneys. That's how everything kind of just keeps going. Like when you're secreting something, that always confused me. Like when she would put secretion of K+, I was like, secretion where? Like where is this secreting out of? Out of the body. So it's just going to keep going. It's not going to be back absorbed. Vitamin D is made in the kidneys. So you have vitamin D also sitting along your intestines, which allow calcium to be absorbed. But if you have a problem synthesizing vitamin D, it's something to do with the kidneys. Don't ask me where. I just know that they're correlated in that, the synthesization of vitamin D kidneys. No, vitamin D reabsorbs it, so it's going to increase calcium levels in the blood. If you have no vitamin D, you cannot absorb calcium, and that's where you have problems like rickets and stuff. The kid disease is if they don't have enough vitamin D, they have bone disorders because you can't reabsorb that calcium. And that's the other thing is that, this just triggered. She asked a question about testosterone and also about like, it was the other day in class, and I thought this was a great question because it made me think even. And it was when she said a 30-year-old male has a short stature, no facial hair, no erection, no sex, and a smell disorder. And she asked what hormone can cause signs and symptoms. And it wasn't, like a lot of people thought it was a decrease in testosterone, but it was actually a decrease in the GnRH. And that's because GnRH releases LH and FSH. And so when you have a decrease in erection, or if you have like a decrease where someone's not having sex, what nurtures the sperm is FSH. So if you have no sperm production, you have something wrong with FSH, because that's what's nurturing it. Testosterone is going to be like no facial hair, no muscle, no bone, because it's male secondary sex characteristics. So if you see both of those combined, where someone's having issues with sexual intercourse or anything sexual like that, and then also like with physical attributes, that's testosterone and the serotonin nurturing cells with sperm production. So that's FSH as well. LH is with testosterone, and then FSH is with the serotonin nurturing cells, and so that's why it would be GnRH, because serotonin would be issues with sperm, while FSH would be issues with secondary characteristics. It's like the small things like that. You just don't, it's like hard because you just don't know which clinical questions she's going to ask, but that's like why I ask you guys if you guys need help with like functions, is because of that reason. Is because if you know the functions, then you can like take that problem and be like, okay, I got this. Yes. No, you ask me questions. That is completely what I'm here for. Uh-huh. Prostaglandins, did it say inhibit prostaglandins? Prostaglandins increase fever. And it's saying that aspirin's inhibiting it? Okay. So that was, prostaglandins do increase a fever, create a fever. That's part of the fever mechanism. Must be on the other one. Okay. Okay, so PGE2 release comes from arachidonic acid pathway. This pathway is mediated by the enzyme phospholipase A2 cyclooxygenase and prostaglandins E2 synthesis. This enzyme ultimately mediates the synthesis and release of the PGE2, is the ultimate mediator of the febrile response. So PGE2, I read, where is that at? Okay, so temperature is regulated in the hypothalamus in response to PGE2. So if you have an increase in cyclooxygenase, that's going to increase PGE2. So if you have an inhibition, which PGE2 is the one that releases release to tell the hypothalamus there is a fever. So the more you have an increase in the cyclooxygenase, that means the more of a fever you're going to have. So that's why when you said inhibiting of the cyclooxygenase, that means that clearly PGE2 isn't being stimulated, so that means there's no more fever. That was a really good question. Is it on like a study guide or something? Oh, awesome. Oh, that's really good. That's good that they have more questions for y'all. Because, like, I'm not specifically sure, like I said, how much she's going to hit immune. With my immune, we had, like, 3 questions. But then also she shoved it onto the last test. So that's why I wanted to go over it, because I'm not really sure. Like, we had a lot of questions about the complement protein, like, cycle. So, like, which triggered and what caused what type of thing. That was what our big questions were in the immune. Does anybody else have any questions? Yes. how those correlated. I know what you're talking about. Let me, where's that question at? Like, what other notes do you have around it? I'm just curious. Sorry, she like sporadically did those this time, and so, okay, here, I found it. So a 25-year-old is infertile, polycystic ovarian syndrome, obesity. See, the only one that really called out to me in the first place, I'm going to be honest with you, was the obesity, because the slow metabolism, that's going to cause obesity. Here I'm about to go to their functions and see if it says anything, because I didn't really, because that was one of the ones, I'm going to be honest with you as well, where when she said polycystic ovarian syndrome, I was kind of confused. I didn't really know where that came from or why that had anything to do. So, because like we have bone formation, impaired memory, decreased mental capacity. O2 consumption and BMR are increased by thyroid hormones in all tissues except brain, gonad, and spleen. That's the only time I see gonad. Ventilation rate, increased heart rate, metabolic, increased glucose absorption from glucose, increase, all that breakdown. So I honestly have no idea. I wouldn't expect her to put a question like that on the test, honestly, because and she didn't explain it because I would have wrote it down. Because I was really curious about how that correlated as well. Like, I mean, the sleep problems make sense, obesity, hypotension, arrhythmia, all those make sense to make hypothyroidism, because that's what you're going to get. Because hyper is the complete opposite of that. Yeah, because I thought it was primary Cushing's, because you have obesity, but then the hypotension didn't make sense. So and then it's not Addison's, and it's not hyperthyroid. So I don't know where the polycystic came into play with that, honestly. It could have been primary Addison's, because that one would have had hypotension, obesity. I don't know. Does anybody know that answer to that question? No, right? Okay. And that might be a very good point. She said that maybe she put the polycystic ovarian syndrome just because she said no ovulation, and that would be the syndrome to cause no ovulation, which is very true. So maybe she was just trying to throw us off completely. Any other questions? Yeah, ask. It gets everybody's mind thinking, honestly. Okay. No. So anytime you see growth, it's growth hormone. So actually, wait a minute. Down syndrome. Say it again. Sorry. Say it again. Yeah, I thought it was human growth hormone. That would be the one for Down syndrome like that, because human growth hormone is like growing of the skull as well, growing of bones. That one is one of the ones that are mainly produced as you're in the placenta. So if you want to read me though, does it say a full workup? Prolactin, ACTH, FSH, GnRH, oxytocin. So it's not going to be oxytocin. GnRH would be testosterone, FSH, and then it has FSH. So, and then it's Prolactin, is that what you said? I think prolactin does. Prolactin, and which other one was there? HCG. It might be one that increased, yes, and I wrote it down. Yeah, okay, which makes sense because that's the one that is produced continuously to increase progesterone and estrogen. And so it would have the continuous growth process as in the placenta. I would say, yeah, and that's why it's because like prolactin is milk secretion, so that's why I was like, that one can't have to do with it. HCG, as now I'm remembering, is the one that basically is growing, is making the placenta work, making all like that stuff for the baby work. So normally when you think baby, think HCG. Yeah, you have progesterone, estrogen, but HCG is like one of your main guys for it. She didn't, like, because on the slides, see that, like, though I don't know how in depth you want to go on that stuff because on the slides, there's nothing like that on there, you know. But then in the BRS, I know it goes a lot more in depth. Any other questions? Mm-hmm. Mm-hmm. Yes. Second, okay, so you have a primary osteocyte, primary follicle, secondary follicle, and then the beginning of the secondary osteocyte, but it doesn't completely go through meiosis unless it's fertilized. Totally. So you have primary so you have ogonia and IA. What does IA stand for? Immature. So spermatogonia, gonia, every time you have gonia, it's immature. So ogonia, primary osteocyte, primary follicle, that's when zona pellucidea forms. Secondary follicle, and that's when the other layers form. She gives a word for those. Okay. And then you have the beginning of the secondary osteocyte, but it doesn't go to completion until it's fertilized. So it's not the secondary follicle, it's the secondary osteocyte is when it goes to completion. If it's not fertilized, it won't go to a complete secondary osteocyte. Yes, completely. That's why, like, with fertilization, they have to penetrate to all those layers, is because of that. Yeah, for the follicle stimulating hormone. And so the luteinizing hormone will come into play, no fertilization. It'll start producing and form that stigma, which is the beginning of the breakdown, and then the breakdown completely is the corpus albicans. That's why you have a big surge right before it with LH. Luteinizing, think of luteinizing as like chopping down. I know repro, so many like processes, it's all like one combining. I feel like you have to. Repro has always been like one of my struggle ones that I like try to wrap my brain around, but it's just very intense. I feel like. Any other questions? Are we okay with the immune system? Or is that one? Yeah, is it like one of the ones that haven't been like full force focused, correct, right? Yeah, I know, that one's complicated too. I would really know like, just processes, like with the complement proteins, like I was saying, really know that slide really well and know like what triggers what. That's probably a very good slide to go over. The complement protein slide for immune. That's one of the big ones because I specifically remember having at least 2 questions on that on my test. Know that, like I said, with the process of inflammation, know which cells come first. Know how like mast cells are, it's like you have blood clotting and then you have mast cells that come and release histamine and then neutrophils start coming and then you have your macrophages that come after that. Like, know stuff like that. Know, I would know like antibodies, knowing that like the process of how things get triggered, like starting off with an antigen coming into the body and going all the way down. With like the T cells, how they have to form MHC complexes. There's 2 types. So you have MHC complex 1 and MHC complex 2. Then you have the helper T cells, and then the T cells bind onto that. Know the biggest thing is that antibodies are outside the cells. T cells are inside the cells. So anytime you have a virus, those are inside the cells. That's what T cells attack. Anytime you have bacteria just coming through your system, that's what the B cells attack. B cells are outside cells. So your B cells are normally going to be flowing through your lymph. Lymph is very big, the biggest system for antibody to like flow through. Like I was saying, know that you have an antigen. The epitope is what shows what antigen it is, and that's also what is connected to the antibody to trigger. Once they connect, the antibodies send out signals, and then you have normal antibodies come in, and then also memory antibodies also coming in to remember this system. They're all, and then the biggest thing is they're all produced by plasma protein gamma globulin. All antibodies are. That's the plasma protein for it. I'm trying to think like more like of what the immune, but those are, I would think, big hit points. I think she's really going to hit you guys with, of course, the what's it called? Gosh, endocrine system. I think that's going to be the main focus. And to know the functions means to know the disorders. So really like pay attention to those functions. Know the difference between obesity and with BMR, like metabolism-wise. Know the difference in that, because even if someone has a slow metabolism, that doesn't necessarily mean that they're going to be obese. Know that thyroid also plays an important role with epinephrine and norepinephrine, because they are, thyroid acts like the sympathetic nervous system. So they increase O2 consumption by bronchodilation. They increase your heart rate as well. That's why when you have an increased heart rate, that means your thyroid, you have an increased BMR. Know that thyroid also is going to break down stuff, because the higher metabolism is, the more thyroid hormone means that is being produced, and that means that you're going to need more stuff to have fuel. So if you have hypothyroidism, that means you're going to have a slow heart rate, not great O2 consumption. You're going to be a little bit obese because your metabolism's slow. You're not going to be breaking stuff down as well. Know the names, like I was saying, like catecholamines are norepinephrine and epinephrine. Mineralocorticoids are, aldosterone. No glucocorticoids are cortisol. Know which zona they're in. Zona glomerulus, aldosterone. Glomerulus is part of the kidneys. Aldosterone absorbs and secretes from the kidneys. That's a great way to know those names. Like with the glucocorticoids, cortisol increases your glucose. You're in stress. You're going to have increase because your body thinks that it's in flight or flight syndrome, you know. I'm trying to think. It's a lot, isn't it? It's a lot of information. I know. It is. And it's like, it's just, it'll be to where it comes. Because now I feel like I just talk in circles. Honestly. It all connects to me now. The endocrine system really connects it all. I mean, any questions? Like, any ways? Yeah. Okay. Perfect. Yeah, C5 through C9. That is what assembles. So it's like after C5 stops with C3, it's like C5 through C9. I don't think has she ever hit y'all with a select all apply? No, right? Okay, because she never did with us. That would have been crazy. Oh gosh, micro all over again. Freaking. Okay. Anything? Yes. Huh? Do you want me to go through that process? I can like start with the beginning, and here I'll pull up the slide for it too, because that might be a good process to go over. Because I feel like this will definitely be. So like the best way I think for this is literally make a flow chart, because when you see like what connects with what, it completely makes sense. Like I took a big blank sheet of paper and did the flow chart, and then also put like their functions out to the sides of them, honestly. So it starts with, in a classic pathway, IgG, biggest antibody, okay? That one has the most functions, honestly. IgM activates, so IgG, IgM, I would put that at the top. They activate C1, which catalyzes the hydrolysis of C4 into C4a and C4b. Okay, so hydrolysis means that it breaks it with H2O. So it's just breaking those two in half with water. So C4b, it fragments, binds to the cell membrane, and becomes an active enzyme. So now we're just taking C4b. So C4a is completely left. C4b, then through an intermediate step involving the splitting of C2, C3 is cleaved into C3a and C3b. So because of C4, fragment cell membrane becomes part of an active enzyme. It helps with the splitting of C2 and C3, so C3a and C3b, because C3b then converts C5 into C5a and C5b, because C3a and C5b are the big guys. Those are the ones that release histamine. That's a huge immune response. And then C5a also, again, like I was saying in my thing, is a chemokine to attract neutrophils and monocytes to the site of infection. Neutrophils, they are the ones that eat, so they're coming now. And then monocytes as well. Meanwhile, C5 through C9 are inserted into the bacterial cell membrane to form a membrane attack complex. When those insert, they're going to help the neutrophils kill and the monocytes kill. So it's like writing that out in a flow chart, literally. You'll see which ones matter and which ones don't, which ones have functions and which ones don't. Like, I mean, C4, all it does is completely split C2 and C3. C3a and C5a are the big guys. C5a is the biggest. That's one that does the most info. That was the attack complex. Sorry. The reason why I hooked this one up with the antibody, the B cells, is because this one normally is with B cells, because this is killing bacteria, and bacteria normally aren't ingested in the cell. So it's going to be hit by IgG and IgM, which are both B cells, not T cells. So that's a good thing to also think about. sees like those little things, like catching those little things. No, of course. Here, and that's the flow chart too. Any other questions? Is there, so for like my last like 10 minutes maybe, which out of the immune, the repro, and the endocrine, which one is struggling the most? Immune? Okay. So do you guys want to keep going through immune then? Unless we have questions on the others. So right here, where it says the antigen binding sites up there, that's where the epitope region on the antigen will bind. So antibodies can bind to that. That's where I found the antibody question with gamma. I'm like trying to think of stuff that she would ask, but like I just don't know. I think you just don't like how everybody hasn't really been going too far in depth into it. I don't think you really need to. I think you probably need to focus on the other two the most, especially like repro, because I feel like repro she's going to ask questions on that. Yeah, are we good? Do we have any other questions or? No? Okay. Thank you guys for coming. I hope it was helpful, honestly. No, of course. Those are great to do. Sorry, I can take this off now.